Now we have a Naver Cloud sponsor session, and the presentation is titled Naver Cloud Introduction for Naver Medical Cloud. So we will hear from Jae-jun Ryu of Healthcare Division of Naver. It is great to be here. As was introduced, I am Ryu Jae-jun working at Naver Cloud. Today, I would like to talk about our cloud business, and there needs to be the utilization of medical data, and there are some areas that we will need to reinforce. And in order to have efficient learning of medical data, what is needed, and in the cloud, from hospitals and from companies, what are they using in the cloud? So some cases. First, I would like to start off by talking about diverse cyber attacks and trends in the internet and in the cloud. Now, anybody can use this, and we see huge amounts of malware. There are many different methodologies that are emerging, and looking at the trends per day, 450,000 cases of malware. So we can see that in Q1 of 2021, 55 million new malware is being discovered. This is a tremendous amount. Looking at the trend of malware during the past decade, we see a 14% increase per annum, and in 2019 it was 1 billion. In 2020 it was about 1.14 billion. There were hacking incidents in 2019, and classifying them into different categories, you can see a great amount was personal information leakages. We had some system intrusions, or there were some mistakes made by people that led to the leakage of personal information. And you can see that the total number of personal information leakage was about 1.6 billion. And we have 50 million cases in Korea. And we have seen in the media many cases of personal information leakage. So this is a very serious problem. Also, for cryptocurrency, we see many cases of hackers, and the amount of losses is about 300 billion Korean won, which is quite an amount. Looking at the infringement incidents for different categories and industries, we can see them domestically and globally. And it seems to be showing a similar trend, but in Korea, we see many more medical data infringements in Korea. There are two main reasons for that. And in Korea, we don't have a lot of security by hospitals or entities that have the medical information in some cases. And for the medically sensitive information, it is quite hard to handle, but in some cases, people are more lenient, or they are not aware of the importance enough. So that is why it seems that we have higher incident rate compared to the global average. In February of 2020, we had the revision of Medical Act, and if there is a infringement, you need to make a report. You can see 5 cases for clinics, 4 for hospital levels, and 3 for general hospitals and higher. And in 2021, you can see similar numbers. So we have in 2020 13 in total, and in 2021 12 in total for hacking incidents of hospitals. These were the ones that were reported, and we think there are more that have been unreported. So if we add them all together, we can assume that there are many hacking incidents into clinics and hospitals. For the clinic hospitals and for the general hospitals, there are many cases when data cannot be recovered by ransomware, and these are seen quite often. Looking at some cases of medical security infringements, there was hacking of university hospital email, and whether they were asking or looking for COVID-19 response method. In Korean university hospitals, some of them are disclosing information about their response to COVID-19, and they became a target in some cases. In the past, when there was internal sharing of information in a hospital, it was a closed basis, but now many things are open. So there are many opportunities when this type of information can catch the eye, and they can be easy targets. Looking at the different hospitals, for the tertiary hospitals with ISMS, they are very much security ready. But there are also other hospitals that are not ready in terms of information security, so we see many infringements. You can see the headline, which is famous hospital was also breached, and there was the leaking of hundreds of thousands of patient information. You can see that when the personal information leaks, if there is good management or surveillance of the information, you can respond very quickly and you can be proactive and prevent this. But if you don't have this type of system, then you can only find out after the breach has happened. There was also hacking of Seoul National Hospital, and it was officially reported that it was done by North Korea, and people voiced concerns that important personalities' medical records could be leaked. This is very important data, which is very personal and important. And if this is leaked, then this can be quite a lethal blow for many people. This is not only Seoul National Hospital that was hacked. The Catholic University of Korea Seoul St. Mary's Hospital also had the leaking of personal information. So this happened during the past 2 months. And there were 100,000 cases of facial recognition, which was related data that was leaked. And this is occurring because of systematic issues or because people do not have enough heightened awareness of the importance of protecting personal data. This is not just limited for Korea. We do have overseas cases as well. In most cases, we have a lot of the leakages and breaches for medical and financial. It is because for medical field and financial field, the data can easily be transacted in financially. So that is why it is said that the medical field and financial field are easily attacked. For the financial industry, they have been making great investments in information protection and security. However, compared to finance, it looks like the medical industry is not making enough investments. So maybe that is why it is more vulnerable. We also need to think of the fact that this is not a variable, but something that is constant in the hospital environment. There needs to be a lot of investment made to protect patient information, but in some cases of Korean hospitals, because they're non-profit, sometimes it's hard for them to make the investment. You can see Anthem, which is the medical insurance company, and 80 million customer information was leaked in 2015, and in 2017 they had to pay 125.4 billion won as a compensation for information leakage, and this was reported widely, and you can see more cases as well. Let's look at the degree of security by different medical institutions. What is the degree of security that they have? For security operations, let's look at what is their status quo. You can see in most cases they don't do security operation and surveillance, and you can see on the left side, there are the tertiary general hospitals, and second, general hospitals, and then the smaller general hospitals, and then clinics. You can see within the box on the right, for the general hospitals, there are many hospitals that do not have security operation. We believe that there will be probably more hospitals and clinics that do not have security operations. And what happens in security operations, if there is a security breach, it will be detected right away and we can respond accordingly. So this can block the leakage of information, but if you don't have the security operations surveillance, then you can only detect this after the breach has happened. So a lot of the information already will have been leaked and utilized for malicious purposes, and sometimes you might have to pay the compensation. Looking at network security for the IDS, IPS, and firewalls, all of that, a lot of that is being done, but encryption or VPN or network segmentation, we still seem to be lacking. We need to make up for these fields. Let's look at DB security, and for the DB access and encryption, a lot of that is being used, but to encrypt the user's passwords or to encrypt the user's unique information and data, well, we seem to have lacking aspects in those areas. For important information, we would also need to have encryption of important information. Apart from PC and web, we need to think about mobile EMR as well. It seems that for PC and web, people might be doing better, but there are trends of having more widespread mobile EMR, and it seems that we need to heighten security. Now I will be talking about the security of Naver Cloud. On the left side, on the diagram, you can see that we have the cloud configuration, and on the in the central, you can see the gray area, which are the cloud servers. And on the left side, you can see internet network, and the white is the server, and you can see the data access route. You can see if there is security operation and surveillance, then automatically through learning, the data will be monitored. So if there is traffic that didn't go through that before, then we can respond accordingly immediately. If there is an issue, for 24 hours, if the traffic is not something that went that way before, this will be analyzed very quickly to see whether it will become an issue, and this will be relayed to the customer as soon as possible so that we can prevent any incidents from happening. This system is not only applied to the cloud, but this is also applicable to Naver portal service and our line service as well. In the Naver portal and line service, you can see that we have equivalent level security there as well. On the right, you can see that there are different types of security products, and when you use these security products, then you can meet the legal requirements and you can prevent security breaches. So the product is very much ready, and you can pick and choose the different options according to your needs. Looking at security monitoring, 24 hours, 7 days a week, 365 days a year. If the hacker chooses to access the file, there is IDS antivirus, IDS WARF antivirus. You can see there are many different stages and 24-hour monitoring by different tools. These tools engage in learning in normal cases, and if there is an irregular event, it will detect right away. And security monitoring and response and analysis, we have the people working all hours. So in some cases, they might have just 2 or 3 people in terms of security, so they will not have many opportunities to learn and accumulate knowledge. But our cloud is being attacked constantly, and all of that is being learned, and knowledge is being accumulated. So we find all the different attack methods, and we are at a very high level of security. What is more important than us having pride is that we have been recognized externally. Of course, the Naver portal and others have not been attacked and breached, and we have the security accreditation that attests to our capability. We have ISMS and public cloud security authentication and ISO 27001, 27017, 018, and for different accreditations and standards, we have acquired most of them. So all the areas offered by Naver Cloud has complete security, and we are providing service that meet the requirements of the many different standards inside and outside of Korea. The fact that we have received the certification means that we are at a global level of security. We are ready, and we have the learnings to attest to that. So this is a great advantage of our cloud. We also talk about network segmentation. So we have the internal network, and the external networks are disassociated, and it can actually block the hacking and intrusions. However, what can be an issue is with COVID-19, we had a lot of remote work. Because of the remote work, when we had the network segmentation, it was hard to access the internal system. So people had to go to work physically and to access the system. So that was an issue. However, you can see if this is done in a VPN, then we can have network segmentation level security, but you can access it via mobile, at your house, at the office. So this is how we can ensure safety. The internal server or storage can be accessed from the outside, and through VPNs, whether it's in a mobile environment or in your home, we can easily access the internal data. When we have this type of internal information center or office, then we have the duplication as well. And in our case, at our cloud, we have doubling or twinning of our data centers. So we have DR, that is real-time DR is possible at our data center. For the most important data, then we can have physical backup of the data, and it can be stored in another location. So we have the dispersion, vaulting backup. Let me go over how we can safely utilize medical or healthcare big data. If a third company or a company wants to use and learn the hospital or other medical data, then they needed to go to the hospital, or they needed to have a certain location to engage in the learning. And in those cases, it was hard for us to know if they copied the data or downloaded the data. However, now we have made something called a data box, so they can just learn from the cloud and get results from the cloud. And we offer the source data for analysis, and there is a box, and there is everything needed for learning. All the cloud-related products are assigned there, and the data is called, and then you can learn in the box on the right side. And after you learn, that data goes back to the data owner, and the results of the learnings are validated, and then it goes back. This will allow us to fundamentally block personal information leakage against the data owner's wishes. And in most cases, there's a sandbox, but when you go there physically and learn, you can't learn all the time. You need to go there at a certain time, so there are geographical and time restrictions. But in our cloud, you can approach it and access it anywhere, anytime. So we offer this type of space. You can see the diagram, and the people doing the analysis will access it using VPN. So you cannot access it via internet. IPS VPN is the only way. And there's a data box on the right, and there are the analysis tools, and you can learn with the data that has been put up there. In the data box, we can have multiple accesses by different members. For example, if there are 10 people or 20 people doing the research, then they can access it simultaneously. Also, we can make n number of research boxes. So at a hospital, different numbers of research groups and multiple numbers of users can work in different boxes. So we offer this in a multiple manner. Let me give you some cases of Naver Cloud Healthcare from 2017. We have been working with different hospitals and companies for our cloud, and there are several cases. And what I'm showing you here is something that is asked by many hospitals and companies. So they ask, what kind of legal restrictions exist and whether we can put all of this information up in the cloud? I have already aforementioned that we received certification for all the requirements, and we are following all the guides in the Medical Act and different relevant laws. So we have PHIS, and Ministry of Information and Communication took the lead in this project, and this 5-year project, and this was concluded this year. And this was to have hospital system on the cloud. So this is not on-prem, but this is on top of the cloud so that the EMR can be used. Currently, in Korea University and Goro Hospital and Ansan Hospital, that's on our cloud. And the PCs that were in the data centers in the hospitals are now in our cloud. So within the hospital, all the EMR information apart from the imaging information is on our cloud, and it is being backed up 24 hours. And Dr. Answer 1.0, which ended late last year, and 2.0, which started recently. And Dr. Answer is when the doctors give treatments. It is to make the different medical devices. So it is like making a Korean type of Watson by IBM. There are many tertiary hospitals, and there were 25 hospitals that participated, 21 companies, and we divided it into 8 diseases, and different companies did the learning for the data. And as a result, many have been accredited as medical equipment, and AI equipment has been made to use at the sites. For example, analyzing the imaging and others is being enabled with this. AI-based emergency health system also exists, and the name has been changed to AI ambulance recently. When there is an emergency, health emergency, more than 100,000 patients go into the ER, and in more than 5,000 cases, they have to go to more than 3 hospitals. It's because they can't get surgery from a certain hospital, so they have to go to another hospital. And they say that more than 5,000 patients are referred. There are many cases when patients die because they lose out on the golden time. And AI ambulance is to know about the patient status when the patient is in the ambulance, and to find out which hospital can treat this patient, and to have real-time queries so that we can have reservation made right away, and the imaging information can be sent to the hospital right away so they can get the help they need as soon as they arrive. This will be concluded this year, and from next year, we will see the empirical application, and this can lead to minimization of patient transports in emergencies, and we can also have shortening of the time it takes from the patient's home to the hospital in an emergency. We are also involved in this as a cloud, so we see the status of the patient, the actions of the emergency staff, and the voice of the emergency staff are turned into data. And AI will be used to find out what kind of treatment is used in these situations. AI will make a judgment, and they will send this information to the National Health Institute, and there are real-time updates there about the status of different hospitals. So real-time reservations can be made, and we can have the treatment that is ready for the patient as soon as they arrive. This is lung cancer detection or diagnosis system. This is one of the diagnoses that is done for free for all Koreans. And for the lung cancer diagnosis, we have AI equipment that will allow us to make a judgment about whether this patient has lung cancer or not. And this is currently being serviced. Well, I think my presentation ended earlier than expected, but it is true that in hospitals and in other clinics, there have been many projects in concert with the government. And one of the most important factors is we need to get fast treatment of a disease, and there needs to be fast diagnosis of, for example, cancer for us to get the right treatment. It's because we are having more and more aged people in our society, and if we do not heighten the treatment level, then we can have our financial resources that will deteriorate in our national insurance system. So we are trying to make many efforts, and we are seeing some deregulation trends, although not everything has been deregulated. The government is working very hard, companies are working very hard so that we can see some improvements at the sites. And this is now being applied empirically. And I believe that although it might not seem like things have been changing, you will soon feel that things are changing. And for AI equipment, there is something that will prescribe medicine for you. For example, for antibiotics, there are great developments in antibiotics, and new antibiotics are launched very often. But it is hard for doctors to get that real-time antibiotics knowledge because they're very busy. But if we can have optimal prescription based on our AI, then it can be more beneficial for the patient. If this can be a result of AI learning, then we can know about the patient's status, and the most optimal medication can be prescribed to the patient. So this is currently in its experimental phase, and if this happens, then the patient will get a chance to take antibiotics at the minimum with the most appropriate level of antibiotics. Another case is regarding PHR data, personal health records, and it is very hard to collect PHR data. It is hard to get consent. It is very sensitive information, but many attempts are being made. So if we have collection of personal data, PHR data, then we can analyze that data, and according to the different categories of patients, we can know what will be the best prescription for the patient. So that is precision medicine, and it may be possible. We have the technical capability, but we need to have more experience and references in the clinical setting. Many efforts are being made by hospitals, companies, and the government. So I believe that in the near future, we might be able to experience these benefits firsthand. Last but not least, I would like to mention that a lot of this was done within the hospitals, but now we have an environment in the cloud where security will not be breached. So what has been happening in the hospitals has moved over securely to the cloud. Thank you very much.